Yeah.
No, don't quote me on that, guys.
Yeah.
We had our friends at Guma Mami were laughing. And let's get to Guma Mami. I don't
Wait.
know.
Okay. So our friends at Guma Mami, did you guys enter the raffle?
Yeah.
We got Monica, Sam, and Jaira. Okay.
Yes.
2 out of 3. Jaira, yes. Oh, now you still
Unmute.
got time.
Use your words, Jaira. Unmute.
I'm vaccinated, but I have not signed up for the car.
You
Or
still
the
got.
money. I
You
didn't
just.
know
You
money
still
was
got time, man.
an option, so
Yeah, it's $10,000
okay.
or a car. Right on. Right. And they already gave one of the Munias, so you should be good this year, or this week. 924. Guma Mami, man, we wanted to bring Sam, Monica, and Jaira on here to talk about. I saw on my friend Angela's Instagram that you guys there's a bunch of positions that you guys are looking for: project supervisor, care workers, independent living mentor, peer support specialist, peer navigators, victim advocates, and office clerks. So, Guma Mami nonprofit, correct?
Yes. Yes. So we're a nonprofit organization uh, providing services to individuals with disabilities.
Right.
And we're actually celebrating our 40th anniversary this year. We're 40 years old.
Love you guys. You guys are awesome. Sam, but I mean, wow, you're looking for that many positions. Is there anyone left working at Guma Mami?
Yes, we're actually expanding one of our programs, and we're also implementing some new projects. And that's why I have Tara and Monica here with me. They're the program managers, and they're the ones who will be supervising some of the or they oversee some of the positions.
Right.
When we talk about the positions, I'll have them give us descriptions of the duties and responsibilities of each of the positions. So
Right. No, I'll just go down the list,
and
Sam, if you don't mind. So the
we're starting. I'm sorry.
Go ahead.
And I was gonna say we're implementing two new projects with Guam PA for Health and the Guam Coalition Against Sexual Assault and Family Violence.
So let's talk about those two programs that you guys are getting into, and what these positions you're hiring will do relative to those two programs. Go ahead.
Okay, yeah. So our new project with the Guam PA for Health and Wellness Center is the goal is to encourage active participation in treatment and services for persons with serious mental illness. And we'll be for that project we'll be hiring a program supervisor who will oversee the program and oversee the peer navigators. The peer navigators, those two positions are specifically for individuals with lived experiences of serious mental illness. And their role will be to work with our community partners and also the families to encourage their family members who experience or who are recovering from mental illness to be more active in their treatment and services. The other program with the Guam Coalition Against Sexual Assault and Family Violence, it's a new program. It's actually an expansion of one of our programs that provides services to individuals with disabilities who are also victims of sexual assault or family violence. Yeah, and that's the victim advocate position. Yeah, and the role of that individual will be to help the victim navigate the service system and the legal process also, and of course to advocate for the rights and safety of the victim. So that so those are the those two programs covered: the program supervisor, peer navigators, and victim advocate. For the program specialist, that's for Chira's program. I'll have her talk about that also.
Go ahead, Jairo.
All right. So the peer support specialist is somebody also with lived experience, and they'll be working under the Guma Mami program, which is a center community-based program that provides, similarly to an outpatient program for mental illness, support services, enrichment, recovery support, training in pre-employment and employment, housing connection, assistance with getting into the or applying for benefits, public benefits, and then just encouraging those who are in recovery to find their natural supports in the community. So a person who has that experience living either in homelessness and with a mental illness, or living with a mental illness, is somebody who will be able to provide the support and the encouragement and kind of just connect with a person who may be going through this for the first time or going through this again in their life. And they're actually the ones who will be leading and facilitating workshops and groups and providing one-on-one support to individuals at our center. So we're looking for part-time positions to be filled, and I would be their one of the managers there, and they will be working with I want to say about 6 other people. I can do my math right. So they would have support and they would not be alone. But yeah, definitely somebody who is looking to encourage another person to move forward in the recovery process within the mental, serious mental illness arena, and things that they go through in that sense. It is a program. Guma Mami is a program that is funded by Guam Behavioral Health and Wellness Center. So of course we do partner with them and work with them and collaborate with them throughout. That's the peer support specialist position.
Right. Sam and Monica and Jairo, let me ask you guys, we're talking about addiction, rehabilitation. How bad is the drug problem with persons with disabilities under Guma Mami's watch?
I can speak from Guma Mami's point of view a little bit. I can say how, I guess on a scale of badness, really, but it's there definitely assistant patients there, especially during the pandemic and then, because we work with those who are also homeless, so there's a lot of stressors, a lot of broken support systems, disconnection from family and friends. And then during the pandemic, an increased disconnection from services that were more readily available. And then a lot of people, of course, just depending on the person, but a lot of people do need that in-person contact, connection. They need to feel that, or, that's a better way of providing a support for them, or it helps them and helps with their coping skills. So I would say that within the Guma Mami circle, we see a lot of people go just back and forth, struggling and then recovering, struggling and recovering, and it's just an ongoing process. It does build resiliency in that person, and they have a lot of strength in that manner, where they're able to handle a lot of things and are able to really support their peers and provide them with encouragement and kind of, share their experience in that there's hope. But it's definitely a struggle because of the limited services, I think, specific to each individual. That's kind of what what they see is lacking. You know, like there's services available, but each person, you know, handles things differently and has different needs. So they kind of are left with what's available and they have to deal with that.
Right.
Yeah.
So basically, you're saying that persons with disabilities are no different from other people, and that they face the same struggles with addiction, right? Sam and Monica, kind of wanted to ask because it's something what Jaira had said about some people needing just that face-to-face involvement, interaction with. I mean, not just Guma Mami, right? With any of these agencies that kind of are on the front line in responding to mental well-being and the social issues. But we saw this with CPS where because of the pandemic and the way people were staying home and there was no interaction, they weren't going out, they ended up with this tremendous backlog of all these. I mean, it was like 1,000 complaints, something crazy like that. What about on Guma Mami's end? What was you guys' status during the pandemic, and are you in a similar situation where kind of when we went to PCOR 2, PCOR 3, that you guys took a look around and said, wow, we got a lot of catching up to do?
Yeah, I'm going to have Monica share our experiences from our residential programs. She's the program manager and the lead treatment specialist for our homes, and we had we experienced the same thing that the island was experiencing, and I'm going to have her share some of the things that we were doing to cope with the situation.
In terms of the housing support programs, I actually oversee 2 homes, the Hinanauta program and the Mary Claire home. So those are actually residential group homes or residential homes for persons with mental illness, right? And so it was a very difficult time, especially because, we have essential workers that have to continue to work regardless 24/7, right? 24 hours a day, 7 days a week. So, it was very difficult for the individuals to go out in the community. We are still, the homes are, we are still very, we try to ensure the safety of the residents in the homes. So right now we're still not taking any visitors. But slowly, we are having the individuals that we support go out into the community. We actually wrote a small grant with, we're very thankful with Gita. And one of the things that we ended up doing was trying to improve the communication system with families. We were able to get some laptops in the home so families can actually virtually chat with other family members. Because that, we've never had this kind of problem where people can't go out in the community, so it was a little challenging, a lot challenging, to ensure the safety of the folks that we do support. I'm very thankful that we had staff that continued to provide the services regardless. Our doors were not closed in terms of our staff. They had to report to the homes, or else we're not going to be able to support these individuals that live in the home. So I really applaud the staff for doing that. The families were very, very good in terms of virtually meeting. We had to have, even in terms of meeting with their psychologists on a monthly basis, we were still able to do that virtually. We were still able to, we do have a partnership. I've actually, also with American Medical Center, one of the, I'm sure you'll know of her, Dr. Neil Kelly. So I know that she's done some shows with you as well. Yeah, so she actually comes to the home once a month, and she was providing some of that support so that the residents didn't have to go out to receive those medical services. And she ended up doing some of the assessments and the follow through and helping us with sort out some of those issues,
Sam?
Yes, and for our Second Mommy program, which provides day and evening programs for those who are also experiencing homelessness. We're still recovering from this COVID situation. I know the members or the consumers of that program have sent me videos and letters and stuff asking to open up the center again.
Right.
But I just want to assure them that we're working on that. We're still trying to open. Uh, we still have to go through public health approval and check with our funding source. If we really can open up that program, I mean the facility. As of now, the services that we provide are done virtually. Also, the only thing that we do kind of in person, but in um, applying the social distancing mandate is passing out of food every evening, and not every evening from Monday to Friday, we still give out our usual dinner snacks for the members, and they just come by the facility, and the staff just hand out the food there. But yeah, we're and I know it's a very difficult situation for the members.
Yeah.
They've been asking, and they've been, I know they're trying to send me different messages to have the center open up again, but we wanna open it in a way where it's safe for everyone, for the members and for the staff also.
You know what? I get a lot of messages from Sam. Who I get a lot of messages from are homeless individuals who were kicked out of the shelter over there at the Global Dorm, and they're messaging me. I mean, it's so sad because they had this opportunity at the shelter, but now they can't go back there, and they're asking about the second shelter opening, and they're also asking about what happens to them now. Now that they, blew that chance, I guess, to be housed at a Global Dorm. So I mean, I feel for them because it's a difficult Global Dorm's a difficult situation. You know what I mean, with the location, with who they're actually trying to house there. It's more of a family. It's supposed to be more for the families, right? So I think some of the individuals are had a hard time adjusting, right? I mean, when you go from homeless, doing whatever you're doing to survive, to a more structured environment, a lot of times it's a difficult fit, right?
Mm-hmm. Mm-hmm. Yes, and one of the things that I can say is that Guma Mami is a member of the Guam Homeless Coalition,
Right.
And one of the systems that we have in place within the coalition is we try to apply this as a no wrong tour policy, whereas if a homeless individual shows up at a tour of one of the providers or one of the members, what we try to do is to help them or assist them to get to the appropriate service providers. So I can say, like, if even for us at Guma Mami, although our focus is on individuals with disabilities,
Right.
if we have homeless individuals who reach out to us, we do take their information and try to refer them through the Homeless Coalition network.
That's good to hear. Guma Mami, Sam, let's get you on in a couple weeks to kind of catch up with these new programs. And then maybe,
yes,
because we haven't heard from you. I was looking at my WhatsApp, and I think the last time I heard from you was in November of last year. So we definitely want to keep this conversation current.
Mm-hmm.
You know what I mean?
Mm-hmm.
Jaira, thank you.
Thank you. Thanks for the time.
Monica,
Take care.
of course. Appreciate your time this morning, Monica.
Yes, please come out and apply to for our positions. It's a fun place to work. I want to share that with our home. We don't have a high turnover rate, which is really good. But we do, sometimes people need to leave off island. So
Right.
please come out and apply for the independent living mentor position. It's a lot of fun. I've been doing this ever since, over
Oh,
25 years.
Oh,
I was saying the organization opened in what year? 82. I've been here for, I don't want to even go there. So it's only like 22. But I was only 22, but you know what? It's a fun place to work, and we have a great director that allows us to strengthen our organization. We have a very good staffing structure, and please come out and apply for the position. Okay.
Got it. Thank you, guys.
All right. Thank you, Chris. Thank you all.
Okay, Sam, take it easy, my friend. There you go.
Okay.
Guma Mami, 9:44. It's Wednesday, June 23rd. Coming up, The Greater Good, which is a segment where we highlight people in the community who are doing good work. And we definitely have that with our featured guests for The Greater Good segment. Before we get to that, though, we're going to get to this. Burger King, guys. You know what? Today